We're focusing on bridging the gap, accelerating advanced practice nursing in the U.A.E. Now, this is our 4th day at Arab Health. We've had 3 days of action-packed programming, and I think you'll all agree that we've brought you the rock star, illustrious speakers gracing our stage to share their expertise, and this panel really does set the bar very high and builds on that. Without further ado, may I please invite my wonderful panelists on stage, one by one, and to take their seats under their name. Dr. Sumaya El-Balushi, the Director of Nursing, Emirates Health Services. Professor Suzanne Molt, the Associate Professor at the University of Wollongong, Dubai. Julie Zakaria, the nurse practitioner and senior nursing instructor at Fatima College of Health Sciences. And Teresa Quinn, the Senior Director of Clinical Operations, M42. And I'm very fortunate that I've been asked to moderate this panel. So without further ado, allow me to first come to you, Dr. Sumaya El-Balushi. We are so pleased that you've taken the time out of your very busy schedule, along with the panelists, to be with us here today. For those of you who don't know Dr. Sumaya, allow me to please give her a full introduction. A trailblazer in nursing and the first Emirati Fellow of the American Academy of Nursing. So it's such a pleasure to have you here with our wonderful panelists. Another round of applause, please. Dr. Sumaya, when we talk about this issue of ANP, can we first of all get your insights on the U.A.E. National Strategy Framework for Nursing and Midwifery, and this idea of a roadmap to 2026 that I've been briefed about, which sounds very exciting.
Thank you very much. It's a pleasure to be with you today and talk about the national strategy and the framework for the nursing and midwife for the whole country. We started working on this roadmap, and the roadmap is for the coming 5 years. The roadmap based on 5 pillars that are concerned with the whole nursing profession. The whole strategy is aiming to strengthen the current nursing and midwifery practice, education, research, and the whole system of the nursing, making it attractive for all the Emirati nurses, Emirati youth to join the nursing profession. Also, it is aiming to prepare the country for any disasters or any emergency that we need. The first pillar that is important for us is the workforce, and we need a sustainable workforce for the whole country. The second pillar talk about the innovative and quality education and professional development for the nurses. The third pillar talking about the nursing quality of practice. And the fourth is talking about the nursing research. And all these pillars working together to strengthen the nursing system in the countries. And we were glad to announce that the system is really established well on a roadmap. And you will hear about it when the practitioners and the frameworks talk about. I'll be glad more if you would like to elaborate or you ask me more questions about the national strategy. This national strategy, in fact, have been done by the nurses themselves at the country level. So a lot of workshops and involvement of all the youth, all the senior nurses were involved with the stakeholders in collaboration with the International Council of Nursing and WHO. We are glad that the framework is set up for each nurse, each individual organization to use it as a roadmap to strengthen. It's not only the nursing system, because we don't want to say the nurses are the backbone, because that's the reality. They are going to strengthen the whole health system. So the nurses composed in the country about 50%. Thank you very much.
Thank you so much, Dr. Sumaya. And I think the idea there that you described, that this really has been informed by people on the front line, that is hugely empowering and very reassuring for patients. I'm going to bring in Teresa now. Dr. Sumaya used that astute word there, framework. Let's explore that a little bit more.
So I think the framework is setting the scene for us to be able to introduce advanced practice into our healthcare organisations. The next steps is going to be, how do we work with the educational institutes, and how does the healthcare organisations work together to be able to bring the new graduates onto, dedicated pathways to advance their practice into the different specialities that we need them in across the region. We know that there is a global shortage of healthcare professionals, so by 2030 we're going to feel that impact across the world. So this is one of the ways that we can start to fill those gaps, fill the gaps from the physicians. We're in a society where chronic disease is increasing and we've an aging society, and again that advanced nurse practice is going to be able to help fill some of those gaps. So really for us the next steps forward is going to be working quite closely with our educational institute partners to be able to create those pathways across our healthcare organisations to support nurses to take their practice to the next level.
And I think there, Teresa, the key words there you use is this idea of a shortage of healthcare professionals, which really builds on Dr. Samaya's point about creating a sustainable workforce. So this is really necessary. You seamlessly bring in the educational institutional partner. So on that note, Professor Suzanne, may I please bring you in to elaborate on this point?
Yes. So we've been, the University of Wollongong has really had a wonderful partnership in the planning and working on this strategic plan. I'm actually part of the task group responsible for the advanced nurses scope of practice. Research has shown consistently that advanced practice nurses affect positive change in patient outcomes. And so that's why it is a central pillar. Not only does it keep patients out of hospitals, keeps the community healthy and well, but also when they actually come in to chronic care, managing them in the community is such an important piece. And so the education part of this is where we establish programs that are articulated so that individuals can enter into the program at a postgraduate level, postgraduate certificate, postgraduate diploma, and then a master's in a specialty program in order to be able to then practice in advanced practice roles.
And I think that's just really, it sounds very astute to address the problem right now in a very comprehensive way of addressing the problem, taking it right back to the educational point where you bring in the nurses and it's informed by the nurses' experience there. You mentioned that this is all about improving the patient experience in the end. So it's taking that end goal and understanding how you can engineer towards that. Julie, you've been waiting patiently at the end. Of course, you're coming to us from the Fatima College of Health Sciences. Please bring in your experience.
So as an advanced practice nurse here amongst working in the U.A.E. clinically and both now in education. So the advanced nursing practice role is now we're looking to align with the nursing midwifery strategy roadmap to 2026. So the role of the nurse practitioner is really in community-based clinics, in the outpatient departments and satellite clinics of the hospitals. And as Susie had mentioned, it's really health promotion and prevention. So working and being advocates for our patients, which are members of the community, and most importantly now that the demographics are constantly changing in the U.A.E. and the population, as we see, is increasing with combination of this 2030 healthcare provider shortage. So that's where the advanced nursing practice or advanced practice nurse will really go in and advocate and be members of the healthcare community.
Fantastic, thank you. And sorry, Professor Suzanne, please jump in.
I think it's really important to appreciate that the nursing profession, as we know, commences at the bachelor's level. And then we know through the research and advanced education that the peak of their practice is the advanced practice nurse. And as I mentioned again and again, this has been shown throughout health systems across the world to have a positive impact on the health system as a whole, because it's more cost effective, because ultimately keeping patients out of hospital as the conditions become more chronic and we live longer, we don't want them to be in hospital. We want to be able to care for them in the community. And likewise, the technology is getting so good that we're able to do that. And so when you have a nurse practicing at the peak of their professional practice, they're able to fulfill these roles.
And I'm really glad that you emphasise that point. I know Teresa wants to jump in. I'm going to bring in Dr. Samaya in just a moment. So Teresa, go.
It's so important what Susie is saying. We're leaning ourselves towards sustainable healthcare. We want to shift that focus away from that acute care provision. We want to move towards prevention, health promotion, care in the community, and delivering that through technology, through advanced practice. So the way that we go on, we continue to progress these roles is going to be so important for the future.
And I think the other point, Teresa, to build on what you've just said there, and the experience that we're hearing and clearly being represented here on the stage, the U.A.E. really prospers from celebrating the wonderful Emirati talent here that are collaborating with international partners, both here in the country and elsewhere as well. Professor Suzanne talked about how this has been shown on a global standard that this is the way forward. Dr. Samaya, here speaking about the U.A.E. National Strategy Framework, and the roadmap to 2026. How can we align with global standards, and why, and how, what can we export globally as well? Because there's a lot that the U.A.E. is at the forefront of exporting to the rest of the world as well.
Yes, now we are looking, of course, you said a critical message. The end result of all what we are talking about and discussing, the roadmap strategy, is giving the best care to our patients and the communities. It's not only quality, but nowadays we are reaching to higher than saying happiness, being the highest, the efficient, the more efficient to give this. Now, to do this, we need to prepare the future workforce, and we have to identify the whole framework for the whole country. We noticed lately the word nurse practitioner, advanced practice nurse, registered nurse, specialized nurse, assistant physician. Many terms have been used. So in the globe, in each country, they adopt their own standards. The U.A.E. would like to be unique, so that's why the task force is working hardly to identify what will be the scopes, what are the framework that we are going to use, how we are going to bridge the gap between the education and the practice, who's going to be the right role model for the nurses in order to be able to give that best care we are talking about. So from the national strategy, we are studying the whole framework of what is the specialization model within a healthcare system. So we want to identify, it's not about which level the nurse is, but what are the clinical career path available for the Emirati and the other nurses in order to join this workforce. What will make them to be attractive? As Susan said, they are technology, and many jobs will be done by AI, technology, and other things. But the future job is still the nursing, that we need her in an advanced role. She has to act through her full potential. And that's why the framework will identify for the nurses in the country what title to be used, which level they are, and each level, what are the experience and the qualifications are required. So we are working closely with the education and academics as well as the practice, and see the practice, what they are demand, what are the specialization that they would like to have, what are the area priority that really meet the health priorities of the countries. In addition, we will support those decisions by taking research. So we are doing continuous research at the national level, building capacity actually. We need to do a lot about building the capacity. So this is in brief what the nurse leaders and the stakeholder are doing for all the nurses and health system. And this cannot be succeeded without the support from the nurses themselves, without adopting the right practice, the right quality of the work, the right service. And they have to be the patient advocate and raise their voice. What are their urgent priorities to support the health system in the United Arab Emirates? We are trying to invest in nurses. So the word invest is always recurrent. We need to use it because nurses are no more cost. They are investment for the country, investment for the real patient's journey, which is the whole vision of the country, that we provide the right service with the right people, with the right skills at the right time. So we no more even talking about satisfaction, we are talking about the happiness, that we need to give the service before even they ask. So that's the most important in our framework for the whole strategy.
That's a hugely empowering message there, Dr. Samaya. And just to emphasize the point there, I began by asking Dr. Samaya about the global standards of what can be learnt internationally, but what can be exported. And I think that can be exported, the idea of investment. We all have international experience. We can look at the rest of the world. And nurses really are the forgotten frontline staff. The word investment is not associated with them. So if the U.A.E. can be an example of that, that is hugely powerful. Some of the problems and barriers and challenges we're talking about here are international. They are seen elsewhere, but possibly the solutions are not seen elsewhere, which is what M42 are celebrating here today. Professor Suzanne, you've been very patient there. I'm going to bring you in, but just wanted to emphasize a celebration of investment.
I just wanted to say that COVID demonstrated very clearly how critical the nurse is, and other healthcare professionals, but essentially the nurse is the backbone to the health system. And if we don't invest in them, and if we don't invest in their ability to continually advance, we'll lose them. Nurses have become the most mobile workforce in the world because they're wanted and needed everywhere. And so we need to, as Dr. Samaya pointed out, and Therese, we need to invest in them. We need to employ them in a way that keeps them satisfied and engaged. I think the other really important piece is that advanced education supports the nurse to be active in the research. It gives them the skills to do that. And they're so uniquely positioned from that frontline position to actually do really informed, critical research.
Absolutely,
And I think this
that's
is
a very
something that
astute
Julie...
point. And that's a very astute point because you're actually drawing on real life experience to inform the strategies behind this. Julie, I'm going to come to you, but just to say, we're going to open it up to the audience in just a moment. Please have your questions ready. Put your thinking caps on. Julie.
So yes, as far as research, so the nurse, the bedside nurse, she's using her already adept skills of assessment and knowledge, and as an advanced practice nurse, she would be able to go into clinical research and be an important member of a clinical research trials, but also implementing evidence-based practice, which is, a famous term that nurses always love to use. So the two different sides of the coin, the clinical side of the advanced practice with their clinical trials and advancing research in the name of nursing, and then also implementing and promoting quality and patient outcomes with the evidence-based practice.
Fantastic, thank you. And you're absolutely right to emphasize, I've written it down there, evidence-based practice. Because really, what other evidence is there to look at? Otherwise, it is just theoretical. But if it's informed from that frontline experience, now my frontline audience, please don't let me down. Are there questions? Brilliant. We've got enthusiastic gentlemen. I'm not going to relinquish my mic if I can possibly. Teresa, would you mind just giving your mic up for just a moment? Thank you. As you can see, I like to be in control, so I cannot give you my mic. Ask your question, please, sir.
Thank you so much. Very thoughtful discussion. I'm in nursing leadership, and
Who are you with? It's good to know.
Chief Nursing Officer, Johns Hopkins Aramco Healthcare in Saudi Arabia.
Perfect.
We are sitting in the same dilemma of trying to advance nursing practice and have nurses practice on top of their license. Then we run into the realities of regulatory, licensure, and reimbursement, so insurance. So the landscape around us in this part of the world still does not support the advanced nurse practice. We can work on academia, we can work on expanding their scope of practice within the organization, but then we have the other realities that we need to deal with. So what are you doing? Maybe interested in maybe hearing Dr. Belushi. What are you working? Because the work that you could be doing here in U.A.E. could actually have a significant impact on the rest of the GCC. The second part of the question, what do we do when it comes to the community image of advanced practice nurses, and how do we overcome that and improve the confidence in our abilities to deliver care that is on par or even higher quality than that of our physician colleagues?
Okay, thank you so much. Very comprehensive questioning there. Thank you. So the idea of what can we be doing here to address some of those very real challenges. Dr. Samaya, if you'd like to take that.
Yeah, you were talking, of course, to tell you the national strategy for nursing and midwifery. for the UAE is based on, we get, as I said, from the WHO, which already called for the global strategy for nursing and midwifery. And we have a regional strategy for nursing and midwives. So when I did the national strategy specific to UAE, telling you the nurse leaders around the country were part of us to benchmark them, and they benchmark us also right now with this roadmap, and Saudi Arabia is doing a great job with the revision of 2030. So, and we are having the Nursing Arab Board specialized body at the regional level. And the first specialization that is approved, which is the Emergency Arab Board. And it's open to the country right now with a clear lookbook and everything. And we have a community also residency program related to, under the Arab Board, similar to physician. Telling you more, within the national strategy, we are collaborating with the National Health Institute specialization in UAE. So we have the Emirati board in nursing also, residencies, that will add up to the specialized role. We just finished the transition to practice program residency. We are going to launch the mental, the critical care, as well as the emergency nursing under Emirati board. So that's what I was telling, the whole framework, and that can be beneficial to the region as well as we get benefit, because we talked about evidence-based practice, what research is, what did they tried, and what we are trying to reach to, because we have a different diverse community. So the UAE can get really benefit from those global and regional, as well as we would like to be the pioneer and start, they can benchmark us in those things.
Thank you so much, Dr. Samai. Does anybody else want to come in on that particular question?
So as part, it's a really important conversation about understanding the barriers. And so part of the work of the task group for the advanced practice strategic pillar is a research project that we're undertaking to better learn what those barriers are, and then make it very unique to here, and then put in place strategies to address those. Because as you said, there are lots there. We can stand back and say, well, it's this, 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 and this, but until we actually engage and get involved in the workforce, as Dr. Samai is pointing out, we won't know them. And that's when we're going to do that.
Professor Suzanne, you astutely bring us back to the title there of the session, Bridging the Gap, by addressing those barriers there. We are out of time, but I just want to give each of my panelists one last comment, if I may. If we're talking about bridging the gap, what would be your personal hope to really prioritize in advancing this particular line? Julie, if I may begin with you.
Advancing.
Advancing the acceleration of the advanced practice of nursing in the UAE. What would you say is the top priority going forward?
So, as Dr. Samaya and Susie and Teresa had all mentioned, they're working tirelessly to make this more appealing to the nationals, which me at Fatima College, I can tell you that the girls are in the nursing department there are very enthusiastic, very ambitious, and I think that's really going to be what promotes advanced practice nursing across all of the spectrums, midwifery, clinical nurse specialist, nurse practitioner, is when it becomes nationalized and they are graduating with their bachelor's and looking forward to moving on with their master's.
Fantastic. So make it more appealing, and you're saying it can be done.
Yes.
Professor Suzanne.
I think a critical point is, as Dr. Samaya pointed out, is for the executive teams within the health system to start looking at how their workforce can include the nurse practitioner role. Because there's nothing worse than being educated to your top level and then going out into the clinical environment and not being able to practice that way. So, and it's only the executives of the healthcare system that can do that. So they need to really rework and rethink and remodel the deliveries of care in order to introduce, and this is where Therese is such a trailblazer there.
Absolutely. We'll pass the mic on to Teresa to come in there. As you emphasise there, that top level intervention is crucial. Teresa?
I agree with what Susie is saying. We need country leadership buy-in to this, because as you have mentioned, we need the finance people to also agree with the PQR people so that we can really implement this, and that the finance people are communicating to the insurance companies And overall, the system sees a shift away from sick care to healthcare. So when we introduce these kind of roles, we really see the benefit of them.
Absolutely, and to plug M42 here, because we've been very good and we haven't plugged so much, but that idea of the partnership which brings that to the foreground, those very issues that you've summed up there, Teresa. Our last word to Dr. Samaya, our trailblazer, if you may, just emphasize what's the priority going forward, the key priority for you personally.
My key priority area is to bridge the gap between education and practice and making them work together to reach the best model that serves the country. And then I'm ready to take it forward with the leadership of the country to put it on the table with the right regulations to support this in order to go ahead. So we need more capacity and more teams, and this partnership is going to make the work progress more.
That's so exciting. And I love the fact that you're saying that all of this knowledge exchange is something that you personally, with your fantastic team members, can take forward. And it makes panel discussions like this actually very vital. Not only are we celebrating the hard work that's going on, but also collecting the new ideas that you'll be able to take forward as well. We're privileged to be a part of this. We're privileged to support this very important initiative. Ladies and gentlemen, please do give my panelists a wonderful round of applause. Dr. Samaya, Professor Suzanne, Julie, and Teresa.